Hello everyone. In this particular video we're going to be covering the posterior lower limb musculature and vasculature. For our Rutgers lab students, be sure to have the lower extremity musculature handout in front of you along with the posterior lower limb arteries drawing. Even though arteries are only represented on that drawing, there are a few veins and nerves that we do want you to know. So go ahead and draw those veins and nerves in as we go along here, or you can just make a separate note of them on that particular handout. As we go through the video, please be patient. There will be a few spots where I'm going to have to adjust the camera and change my gloves. So again, please be patient during those moments. So let me just provide a little bit of orientation here. We're looking at the female cadaver. The body is currently lying in a prone position. So the body's lying on its stomach so that the posterior side here is exposed to us. All right, so we're looking at the posterior side of the body here. So this is going to be the left side of the body. The right side of the body would be over in that direction. The head would be all the way up there, right, further up in that direction. Right. The knee, and then eventually the leg and the feet, right, they would eventually be down in this direction over here. All right, so again, we're looking at the gluteal region first here on the left lower limb of the female cadaver. Okay, so again, we're in the posterior side of the left lower limb to the female cadaver. Let's go ahead and start looking at some of the muscles that we have here. As we go through, as I point out the muscles, I'm not going to be mentioning their functions. Those are already listed for you in the handouts. Let's begin here in the gluteal region. First muscle that we have is going to be the Gluteus Maximus. The Gluteus Maximus. And it's going to be this muscle that we have right here that I'm outlining with the forceps. So the Gluteus Maximus is the largest, the strongest, the heaviest, and most coarsely fibered muscle that we have in the entire body. This muscle right here, Gluteus Maximus. Okay, so this muscle that we have going out like this. The Gluteus Maximus has been cut into two portions. All right, so there's one end of it right there, and this is the other end right here. Be sure to take note of the cross-section for this particular muscle. You will see that it is thicker by far than any muscle we've encountered so far and will encounter later as we go through this semester. Right, so that's why we designate it as the strongest, most powerful muscle in the body. Right, so Gluteus Maximus, again, separated into two portions right here. You should also note that as you follow the Gluteus Maximus out laterally here, there's a good portion of the muscle that will eventually attach to and become continuous with a structure that's right here. And this structure that it's becoming continuous with and joining is something that's referred to as the Iliotibial Tract. The Iliotibial Tract. It's more commonly referred to as the iliotibial band, or IT band for short. And you can follow that out. So here's the underside of the Gluteus Maximus. So you can reach in like this, and you might just be able to make out the tip of my index finger right over there. And this soft tissue structure that we have over here is called the iliotibial tract, the iliotibial band. So we have some deep fascia that covers over the thigh muscles, which is referred to as fascia lata, and it thickens significantly over on the side of the thigh here, and it forms this IT band. Right, so there are two muscles we want to associate with the IT band. The one that's here in the posterior side is of course the Gluteus Maximus. When we get over to the anterior side, the muscle that's going to be really attaching to and continuous with the IT band is going to be the tensor of the fascia lata. So those are the two muscles that become continuous with and attached to this IT band. Really, you want to think of the IT band as a conjoint aponeurosis for those two muscles. All right, so again, this is the Gluteus Maximus that we have right here. Let's go ahead and move that out of the way. All right, we move Gluteus Maximus out of the way. Directly underneath, we're going to find the Gluteus Medius. The Gluteus Medius has also been cut into two portions. So it's going to be this muscle right here. So there's one portion of it right there. This is the other end of it right here. Right, so it's been cut straight through like this. Right, so there's one end of the Gluteus Medius, and we can see the rest of it as this muscle right here. Right, this muscle right here. Right, so Gluteus Medius. You'll note that the muscle itself is going out towards this bony feature that's right here on the femur. That feature is called the greater trochanter. The greater trochanter. This is an osteology feature that you want to be aware of. Right, the greater trochanter of the femur right here. And again, there's the Gluteus Medius. Let's take the medius and we'll move it out of the way here. Directly underneath of the medius, we're going to find this next muscle right here, and that is going to be the Gluteus Minimus. All right, the Gluteus Minimus. Right here. Gluteus Minimus. The next few muscles that we have are going to be the hip stabilizer muscles. All right, the hip stabilizer muscles. So let's zoom in a little bit so we have a better view of all these. The first hip stabilizer that we want to locate is going to be the Piriformis. An easy way to locate the Piriformis is to actually use this vessel, which is right here, right, to find it. So this is what I'm holding right here with the forceps, is the largest nerve that we have in the entire body. This is the sciatic nerve. This is something that you should add into the arteries drawing. So this is part of the vasculature you should be aware of here on the posterior side of the lower limb. So there's the sciatic nerve right there, and it's continuing inferiorly, and we'll be able to follow it down a little bit later on. All right, so there's the sciatic nerve. So what you should do is trace that sciatic nerve superiorly here. So trace it up superiorly until you can no longer see it. Right at that spot where it disappears, there's a muscle located right above that area. Okay? And it's going to be this one right here, and that will be the Piriformis. All right, that will be the Piriformis. Let's continue inferiorly here, so we're heading inferiorly in this direction. The next couple of hip stabilizer muscles that we have are going to be these three right here. So we've got the superior gemellus, the obturator internus right here, and then the inferior gemellus right there. Okay, so superior gemellus, obturator internus is this one here in the middle, and we're mainly seeing the tendon for the obturator internus. And then here is going to be the inferior gemellus right here. So superior gemellus, obturator internus, and then there is the inferior gemellus right there. The next hip stabilizer muscle that we have is going to be this rectangular muscle that we have right over here, this muscle right here, and that's going to be the quadratus femoris. Quadratus femoris. Quadratus femoris. The last hip stabilizer that we have is going to be the obturator externus. From this perspective looking in, obturator externus is not readily visible to us. You would have to look deep to two muscles in order to find the obturator externus. The one here on the posterior side under which you would find it is this one which we just saw, the quadratus femoris. On the anterior side, the muscle under which you would look is called the pectineus. So you would look deep to the pectineus muscle on the anterior side, and then this muscle right here, the quadratus femoris on the posterior side, in order to find that hip stabilizer that we could not see. The way we can indicate it is by reaching underneath of the quadratus femoris. So the muscle belly that it would be touching with the tip of the forceps under this muscle would be the obturator externus. So again, those muscles that I just went over, Piriformis, superior gemellus, obturator internus, inferior gemellus, quadratus femoris, and the obturator externus are collectively referred to as the hip stabilizer muscles. Let's look at some of the other vessels that we have in this area. Next, I'm going to show you the superior gluteal vessels. The superior gluteal vessels. So this was the Gluteus Medius muscle right here. Let's go ahead and move that out of the way. Directly underneath of the Gluteus Medius, we're going to find these vessels that we have right here. So these are the superior gluteal vessels right here. So these are the superior gluteal vessels that I'm holding with the forceps right here. So again, we're directly underneath the Gluteus Medius. So I'm holding up the artery along with the accompanying vein and nerve. So you can just simply refer to them as the superior gluteal vessels. Now let's look for the inferior gluteal vessels. These are going to be directly underneath of the Gluteus Maximus muscle. They're going to be right up here. It's going to be these vessels that we're seeing right here with the forceps. Right, again, they're coursing directly underneath of this muscle right here. That's the gluteus maximus, so these are going to be the inferior gluteal vessels. Inferior gluteal vessels. And of course, as I mentioned before, you should be aware of that sciatic nerve right there. Right? Sciatic nerve. There's another bony feature that you should be aware of, and it's going to be right here. This is something that you can palpate right here. This feature is something that you will find on the hip bone. The name of this feature is going to be the ischial tuberosity. The ischial tuberosity. So this is something we really associate with the hamstring muscles. It's going to be the common superior attachment point for the true hamstring muscles, and we'll see those in just a moment. So you should be aware of that particular feature as well, along with the greater trochanter there. So give me just a moment. Let me move the camera down here. So we're going to be going distally along the lower limb, and we're going to be looking at the posterior thigh here. So give me just a moment. Let me adjust the camera. All right, so we've gone distally here along the lower limb. So heading inferiorly would be going down in this direction. All right, so the knee is right here. The hip was up in this direction. All right, so again, the knee is there, hip is up in this direction. So we're looking at the back of the thigh, so we're looking at our hamstring muscles here. So up here in this direction. So right there again was the ischial tuberosity. So that's the common superior attachment point of the true hamstring muscles. By true hamstring, we mean a muscle that has the attachment point of the ischial tuberosity. And a true hamstring muscle is going to operate beyond both the hip joint up here and the knee joint right down in here. So there's the knee joint, hip joint is right up in this area. So a true hamstring muscle acts at both of those joints. So in the hamstrings, we've got 4 muscles down here. Only 3 of them are going to be true hamstring muscles. So let's look at them. So this is the lateral portion of the thigh. This is the medial side of the thigh. So the hamstring muscle that we have over here on the lateral aspect, this one that I'm holding right here, is going to be the biceps femoris. This is the long head of the biceps femoris that I'm holding right here. The short head of the biceps femoris is going to be this portion right here that we're seeing. So this is the short head of the biceps femoris, and the rest of the muscle is going to be this one right here. That's the long head of the biceps femoris. The short head is not a true hamstring muscle. It is not a true hamstring muscle because it does not extend beyond the hip joint. Right, so biceps femoris long head, and then this will be the biceps femoris short head. They merge together. The tendon will eventually attach to the top of the fibula, which is down in this direction. For the other hamstring muscles, let's head over towards the medial side here. The one that's sitting superficially, this one right here, is going to be the semitendinosus. 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 Let's go ahead and move that one out of the way. Directly underneath, we're going to find this muscle right here, and that will be the semimembranosus. Semimembranosus. Both of these 2 muscles go out towards the tibia. They go out towards the tibia, and they are both true hamstring muscles. So semitendinosus, and then directly underneath of that, we've got the semimembranosus. Let me just point out some of the important vasculature that we have here. So there's the sciatic nerve. Right, we saw this before. We can trace it down here into the back of the thigh, the sciatic nerve. Right, we have a few branches coming off of it, and we can see these right here. Right, these couple of branches right here. So these are individual muscular innervations off of the sciatic nerve, and that sciatic nerve innervates these hamstring muscles, the posterior thigh muscles. And we can trace down the sciatic nerve right here. Okay. As you trace down the sciatic nerve, when you get to this spot right here, you're going to see that it splits into 2. It splits into 2. This is the more medial branch. That's going to be your tibial nerve right there. This one, which is going out laterally, that's going to be the common fibula. I'll come back to those vessels in a little bit. The other vessels that we have visible for us here, if we go to that posterior lower limb arteries drawing, we have these vessels right here. These vessels right here. So these are going to be the popliteal vessels right here. So these are really the continuation of the femoral vessels. So the femoral vessels are seen on the anterior side. They wrap around the thigh, and then as they travel inferiorly, they eventually travel through the adductor canal. The adductor canal will eventually lead you to an opening which is at the distal end of the Adductor Magnus muscle. So if I move those hamstring muscles out of the way here, we can see this muscle right here, which is the largest that we have in the entire thigh. That's the Adductor Magnus muscle. At the distal end of the Adductor Magnus, there's an opening in its aponeurotic tissue. There's an opening in the aponeurotic tissue. The opening is called the Adductor Hiatus. The Adductor Hiatus. And basically you can represent that opening by taking one of the probes here and you can insert it into that Adductor Hiatus. So I'm putting the probe into that adductor canal there. But this initial opening right here is called the Adductor Hiatus. And then emerging through that opening right there are the continuation of the femoral vessels. But since we're in a new area of the body, we're going to be calling them the popliteal vessels. So we've got the popliteal artery right here, and then the popliteal vein right there. Popliteal artery, popliteal vein. Popliteal artery, popliteal vein right there. And again, just to show that branching of the sciatic nerve, here's the sciatic. It's branching here. There's one branch of it, that's the tibial nerve right there. And then this branch right here, that's going to be your common fibular nerve going out laterally there. Alright, so we're going to continue with the posterior leg here. More specifically, let's look at the posterior lateral leg. So continue to flip through your handout there until you get to that section in your handout, the posterior lateral leg muscles. So let's turn the leg here. So this is the posterior view of the leg. So let's go ahead and rotate the lower limb here so that the lateral portion of the leg is visible to us. So we're going to see two muscles over here. So this one that's sitting superficially right here, that's going to be the Fibularis Longus. Fibularis Longus, this muscle right here. If we move that one out of the way, directly underneath we're going to find this muscle right here, and that's going to be the Fibularis Brevis. Fibularis Brevis right here. And we can see that going up right there. So Fibularis Longus, you can trace that muscle going up here. Fibularis Longus, move that out of the way. Directly underneath, Fibularis Brevis. Now going out towards the calf muscles that we have right here. So the most superficial one that we have here in the posterior leg is going to be the Gastrocnemius. The Gastrocnemius. It's consisting of a medial and lateral head over here, a medial and lateral head. The medial head has been cut so that we can go ahead and move it out of the way. Right, so we'll move Gastrocnemius out of the way there. Directly underneath, we're going to find this muscle right here, and that's going to be the Plantaris. All right, the Plantaris. If we hold that one out of the way, that's going to reveal this large muscle here, and that will be the Soleus. All right, the Soleus. So Gastrocnemius, this is how everything sits normally. Again, the medial head has been cut right here, just out of frame, but it's been cut right there. Move the Gastrocnemius out of the way. Plantaris. And then directly underneath we have Soleus. If we move all those out of the way, it's going to reveal this muscle that we have right in here. And this is going to be the popliteus. So this muscle will be the popliteus right here. Now we're going to be looking at the posterior medial leg muscles. So what you should pay attention to are the structures that are here in the back of the leg, and also when it applies, the structure that continues out towards the plantar side of the foot, which I'll show you later on. So I'll be able to indicate the tendons if they go out towards the underside of the foot a little bit later on when I go over the actual plantar foot. But for right now, let's just look at the portions of the muscles that are visible to us. So let's just point out a few of the important osteology features before I go over those muscles. So over here we have the head of the fibula, which you can palpate right here, where my index finger is, right there. The lateral malleolus can be palpated right here, right where the tip of my index finger is right here. That's the lateral malleolus. And then right here we have the medial malleolus. So the one that's closest to it for these posterior leg muscles is going to be the tibialis posterior, this one right here, tibialis posterior. The next one is going to be that one right there. This is the flexor digitorum longus, flexor digitorum longus. And then furthest away from that medial malleolus, all the way over here, is going to be the flexor hallucis longus. All right, flexor hallucis longus. All right, so flexor hallucis longus, flexor digitorum longus, and then closest to that medial malleolus over here is going to be the tibialis posterior. And you can see the tibialis posterior continuing up right there, continuing up in this direction here. And you should note that mainly the gastrocnemius and the soleus, their tendons converge together into this structure that we have right here. And we commonly refer to it, of course, as the Achilles tendon, but you should use the anatomical name, which is going to be calcaneal tendon, the calcaneal tendon. You can also call it the tendocalcaneus if you want to. All right, so there's the calcaneal tendon, and the calcaneal tendon, the Achilles tendon, is the largest one, the largest tendon that we have in the entire body. Let me just point out some of the other vessels that we have here in this particular area. For the veins, right, you should know this particular vessel right here. This vessel that I'm holding right here. It's continuing up superiorly, and it continues as this vessel they're seeing right here. So it's been cut superiorly, but this is going to be the small saphenous vein right here. It's coursing superficial to that gastrocnemius. So there's the small saphenous vein right here. Sitting just next to the small saphenous vein is a superficial nerve, this one right here, and that's going to be called the Sural Nerve. All right, the Sural Nerve. So you should be aware of that. And the Sural Nerve is really a component of two things, one that comes off of the tibial nerve, another that comes off of the common fibular. Those are the medial and lateral sural cutaneous nerves, and they merge together to form that sural nerve right here, and that sural nerve travels alongside the small saphenous vein here. Again, they're superficial to the gastrocnemius, this muscle right here. One thing that you should note about the common fibular nerve which I showed you before. So I showed you the common fibular nerve coming off of the sciatic. We can follow it as this vessel right here. Right, so it's coming down right here, so we can follow it down here. And you should note that the common fibular nerve is going to wrap around this feature that you can palpate right here, and that's going to be the head of the fibula. All right, so the common fibular nerve wraps around both the head and the neck of the fibula right up in there. So moving these muscles out of the way here, you can follow down the tibial nerve right here. So there's the tibial nerve. There's the tibial nerve right here. There's the tibial nerve right there. And as we hold it up here, you can see some of these thin strings coming off of it. So again, there's the tibial nerve. Those thin strings coming off of the tibial nerve there are individual muscular innervations for these posterior leg muscles. So we can follow down that nerve right here, that tibial nerve, and then I'm going to show you the bifurcation in just a moment down here in the foot as we get towards the ankle joint. I will come back a little bit later on to show you the arrangement of the arteries and the veins, which are right here, but that will require me to have the camera zoom in a little bit. But let me go down and show you the plantar side of the foot. We'll cover the structures down there, and then I'll show you the arteries that are here in this region going down. Alright, so again, we're looking at the plantar side of the foot here. Again, we're still on the left lower limb. Let me just point out some of the important features that are visible to us here. So this bone that's right here that you can palpate, that's going to be the calcaneus. It's one of the tarsal bones. And the Achilles tendon, which is just out of frame here, is going down and it's attaching right to that calcaneus bone. The calcaneal tendon is attaching right to this particular bone. So make sure you're aware of that particular tarsal bone, the calcaneus, which will be found right there. We also have a few surface anatomy features that are down here in the foot. This general region right over here, which is closest to the great toe, and again the anatomical name for the great toe is going to be hallux, this toe right here. So this is going to be this area right here. We call this general region the medial plantar eminence. The medial plantar eminence, that surface anatomy feature right there. And then over here on the opposing side, this is the lateral side of the foot, we call this the lateral plantar eminence. Lateral plantar eminence. So let's begin over here on the medial plantar eminence. So the most medial plantar foot muscle that we have is going to be this one right here. That's going to be Adductor Halis. It's been cut away from its normal position right here. So there's Adductor Halis. The tendon for it can be seen right there. So Adductor Halis. The muscle that's located just inside of that, next one on our list, will be this one right here, and that's going to be the Flexor Hallucis Brevis. Flexor Hallucis Brevis. This one right here. We can actually see it kind of divided into two portions. It actually has two heads, if you will. Right, so the Flexor Hallucis Brevis right there, and you can see one portion of it right there, and the other portion of it right over there. So it almost kind of divides into two parts, but we'll just consider it as one unit here. Flexor Hallucis Brevis. Over here on this side, we've got the most lateral plantar foot muscle, and that's going to be our Adductor Digiti Minimi. Adductor Digiti Minimi. Just inside of that, we have this one here. That's going to be your Flexor Digiti Minimi. All right, Flexor Digiti Minimi. And again, there was Adductor Digiti Minimi. The next thing we want to be aware of is this structure that we have right in here. We refer to this flap right here, which has been cut proximally, this area right here. If you notice, it's a little bit lighter in color right in this region right in here. And this structure that we're seeing is called the Plantar Aponeurosis. Plantar Aponeurosis. It's basically a thickening of the deep fascia that sits here in the underside of the foot, the Plantar Aponeurosis. If you take the Plantar Aponeurosis and flip it over, the muscle that you'll see on the underside of the Plantar Aponeurosis is called the Flexor Digitorum Brevis. Flexor Digitorum Brevis. The next muscle we want to locate is going to be the Adductor Halicus. So let's locate the tendon for a muscle that we actually saw up here in the posterior medial leg compartment. So I said that when you follow these structures down, if it applies, you want to look for something moving here in the foot. So that tibialis posterior muscle that I showed you before, and you can see it right there, when you pull on it gently, nothing on the underside of the foot is going to move. Right? That's because it's attaching to structures which are deep to these things that are visible here. So this muscle that I'm pulling on now, this one right here, that is the Flexor Digitorum Longus, and now you can see some movement right here in these tendons. All right, so there's the proximal area of the tendon right in here, and you can follow it as this structure right here. So these are the Flexor Digitorum Longus tendons. Right, so the Flexor Digitorum Longus. And also we had that third muscle in the posterior medial leg. This was the Flexor Hallucis Longus, and the tendon for it is going out right here. Right, so this solitary tendon going out towards the big toe. So just to situate those things. We're now back in the plantar foot here. So again, we were looking at the Adductor Halis. So to find that one, first locate flexor digitorum longus, this one here. Move that out of the way. And this muscle directly underneath here is going to be the Adductor Halis, this muscle right here. All right, so more specifically, it's the oblique head. There is a transverse head which is sitting right in here, but it's not quite visible to us. All right, but again, there's the Adductor Halis there. The next one we should be aware of is going to be the quadratus plantae. Again, locate the flexor digitorum longus tendon that we're seeing right here. We're going to see a small muscle that attaches to those tendons, and it's going to be this one right here, and that's going to be the quadratus plantae, this small muscle just over the forceps right here. It does tendinal tracking on these flexor digitorum longus tendons. So there's the quadratus plantae right there. We also have the lumbricals. These are going to be very small. We don't have great examples here. And they're going to be these thin muscles right here in between the tendons for the flexor digitorum longus. So we've got these very small muscles, again, that are right in here. There's a very small example right in there. And really, when you're in lab, you should locate it on the other foot, on the right side here. There's a much better example of it over on that side. But again, the flexor digitorum longus tendons, they go out like this. The muscles that are located in the spaces between those tendons as they separate, those are the lumbrical muscles. And then we have the plantar interosseous muscles. So again, there's the flexor digitorum longus tendons. Move those out of the way. We located the adductor halicus. If we move those out of the way, directly underneath we would find the plantar interosseous muscles, which would be underneath right in there. So there's the tibial nerve, which I mentioned before. All right, there's the tibial nerve right here. All right, you can follow down the tibial nerve, and right at this spot where I'm indicating it right here, we can see it bifurcate. So actually, let me hold up those two branches first. All right, so there you have these two branches right here. So there's the end of tibial nerve. This branch right here, that's going to be your lateral plantar nerve, and you can see it going out in this direction right here. There's the lateral plantar nerve. This vessel right over here. This vessel right over here, that branch, that's going to be your medial plantar nerve coming over in this direction, and you can follow it out over here, and you can see a direct innervation of it going out towards that flexor digitorum brevis right there. So again, a medial plantar nerve, and then the lateral plantar nerve right there. And just one more thing, the plantar aponeurosis, just to remind you one more time, it's coming off of that calcaneus bone that we saw before. It has been cut right here, so again, that's where you want to be able to reflect it out of the way to see the flexor digitorum brevis, but on this side, that's the plantar aponeurosis. One thing for the arteries, I know I'm going to go back up here and just trace it down in just a moment here for you. But just for right now, just keep this in mind. So right here we have the posterior tibial artery and vein actually going down right here. So this is the posterior tibial artery going down, and it splits just beyond that point where I'm holding it right there. So we've got a lateral plantar artery, this one right here, and then over on this side we have a medial plantar artery. So a lateral and medial plantar artery. But let me go back up and adjust the camera so that we have a much better view of those vessels where they begin here. So just give me a moment, let me adjust the camera, that way we can see them. Alright, so what I'm going to be showing you here is going to be the continuation of your popliteal vessels. So the arrangement of the veins matches your arteries exactly. So your arteries are obviously represented there for you on that drawing. So just know, the veins will follow the arteries as you see them represented for you there in that drawing. So if you were to follow down the popliteal artery, you can follow it down beyond the knee joint. And I'm going to be showing you these next couple of branches here, the arrangement that you have represented in your drawing. Right here, just distal to the knee joint itself. So let's go ahead and look at these vessels. And this was the tibial nerve again. So let's go ahead and move that out of the way here. Move that out of the way. And here we can follow down the popliteal vein right here. But let's stick with the popliteal artery as we see it right here. Okay. All right, so we already saw the popliteal artery and vein emerging from that adductor hiatus. You can trace them down here, just distal to the knee joint. There is the popliteal artery that we can pick up again. So we're again just distal to the knee joint here. So inferior is essentially going down in this direction, so the ankle would be further in this direction. So the knee is just out of frame here. All right, so the knee joint is just out of frame, up in this direction right here. And again, we're on the left posterior lower limb. So here's the popliteal artery. All right, so you can follow that down. The first branch that comes off is going to be the anterior tibial artery. It's this vessel that's diving deep right there. All right, so that's going to be the anterior tibial artery. This is something that you can trace on the anterior side in between the anterior leg muscles. But you should know it here as well so that you don't confuse it with anything else. And again, there's the anterior tibial artery going down in this direction and supplying those anterior leg muscles. Again, all right, so popliteal, that first branch that comes off of it, is the anterior tibial artery right there. The rest of the vessel that continues along the posterior side right here, this is going to be the posterior tibial artery. All right, posterior tibial artery. So we can follow it down as this vessel that we're seeing right here. And right at this spot where I'm holding it, we're going to see the largest branch of the posterior tibial come off here. And on your drawing, it's represented as the fibular artery, and it's this vessel right here. So lateral is over in this direction, medial is over in this direction. All right, so this branch coming off here, that is going to be the fibular artery. All right, fibular artery. The rest of the vessel going down here is the posterior tibial. Okay, so there's fibular artery, and again, there is the posterior tibial. And again, just to set the orientation, as we go inferiorly, we're heading in this direction, down in this way. Right, as we head inferiorly, we're distally along the limb. Right, so posterior tibial artery, there's the continuation of posterior tibial. Going out laterally here is going to be the fibular artery. And again, make sure that you go back earlier in the video where I showed you the posterior tibial continuing inferiorly, and that posterior tibial near the ankle joint is going to split into two, like that as I showed you, splitting into the medial and lateral plantar arteries. Right? Medial and lateral plantar arteries. So again, there's the sciatic nerve right here, and you can see it splitting into those branches that I mentioned before. There is going to be the tibial nerve right there. All right, the tibial nerve right here, and then going out laterally is going to be the common fibular, and that tibial nerve is supplying those posterior leg muscles, which we saw down a little bit earlier, down in the back of the leg a little bit earlier. So there's the tibial nerve going out laterally. Right there is the common fibular. That common fibular is going to be something that you can trace down further. It will eventually split up into the deep and superficial fibular, but those will be nerves that you can see on the anterior side. And just one last thing, this actually has nothing to do with the lower extremity. It's just a view actually of the brain. A number of students have been asking to see some of the deeper structures. So now that we've entered into the second half of the semester, we're no longer obviously covering the brain, but I performed a hemisection of the brain itself. So we've cut it straight down the middle to separate it into two halves. So that's something I thought that you might be interested in seeing. So there, of course, we have the lateral view of the brain itself. So there's a superior view. So essentially what I've done here is I've cut it straight down the middle here to separate it into two portions. So there's essentially a mid-sagittal view of the brain itself. So we're looking into really the left half of it. So this is a middle view, so we just cut it straight down the middle here, so you guys are looking, essentially this is a mid-sagittal view here. So I thought that something our students would like to see. So again, now that the brain has been cut in half, this is something that you can look at in detail when you're reviewing in lab. Thank you for watching.